kwenye hospitali mbalimbali za umma. Tuvuke moja kwa moja tufuatilie mkao huo na wanahabari.
A strike, our joint strike, which is supposed to commence tonight at midnight. The Kenya National Union of Clinical Officers, Kenya National Union of Nurses, Kenya Health Professional Society, Kenya National Union of Laboratory Officers, Kenya National Union of Pharmaceutical Technologists, and Kenya Union of Nutritionists and Dietitians wishes to notify the public that all members will cease offering services effective midnight today after the Ministry of Health failed to address grievances regarding promotions and designations. The strike will affect all port health facilities, including airports, border points, and all port of entry. National Spinal Injury Hospital, Madare Hospital, Odaya Hospital, Blood Bank, National Public Health Labs, and all other facilities served by our members working under the Ministry of Health. On 4th May 2020, the unions jointly issued a strike notice regarding the welfare of health workers on promotions and redesignations, among other items. On 18th May 2020, the Cabinet Secretary initiated conciliatory meetings with representatives of all employers in the public health sector, including the Ministry of Health. Though the unions showed goodwill and compliance with the law by suspending the strike, the discussions have remained unfruitful. On 20th August 2020, on the basis that the ministry had committed to fast-track promotions and redesignation, the joint union suspended the strike for the second time. On 7th October 2020, we issued a demand letter to the ministry demanding a response on the status and nature of promotions. This letter was never responded to, nor did they convene any meeting. On 19th of October 2020, we issued a 7-day strike notice, which is commencing today at midnight. No communication has come from Afya House since then. It's clear that they don't care whether Kenyans suffer withdrawal of services or not. It's demoralizing that the ministry has over the years promised to effect promotions for the undersigned affected cadres, only to backtrack later and employ delay tactics that have seen officers stagnate in one job group over 15 years. The situation has become so bad that most of the discriminated professionals, head of departments within the Ministry of Health, are several job groups below their juniors in some counties who are supposed to lead. So therefore, today at midnight, all of us, all health cadres that are working under the Ministry of Health, that is Afya House, we are going to down our tools until they promote us and redesignate us. This has been an historical injustice. They have been unfair to us. We've tried all we could, having a discussion to see that they have promoted our members. But it has become a cat and mouse game. So, this is to tell them we are not going to offer any more services to our Kenyans. Thank you.
Thanks a lot, Katibu. We can have the KHPS chair be able to give his remarks.
Good morning, members of the Port State. My name I'm also the Secretary General for Association of Public Health Officers Kenya. I think I'm short of words because, as earlier alluded by the chairman of Kenya Union of Clinical Officers, we have started this journey of appealing for promotion for the last 15 years, well before the devolution. And when our fellow colleagues were devolved to the counties, the County Public Service Board were also formulated. And so the historical injustice that has been at Afya House before devolution were removed because their promotion were fast-tracked. But here at the national level, despite the fact that we have the human resource that can be able to fast-track those promotions and resignation, nothing has happened to date. We have appealed, we have written a protest letter to the ministry. From May, we have called a strike. We have pulled off the strike. Nothing happens. Even as we protest, even physically and even through letters, ni kama tunaongea na mawe. I think the people at Afya House, the administration at Afya House, they are there to manage the health workforce and as well to manage the delivery of services to Kenyans. But they don't justify their presence in Afya House because they are not responsive to the concern of health workers that remain at national level. People at the point of entries, people working in the programs at national level, guys at Afya House, they have stagnated for the last 15 years.
Na mtazamaji, ni miungano mbalimbali hiyo ya matabibu ama wahudumu wa afya hapa nchini ikitoa ilani ya mgomo ambao unafaa kuanza usiku wa leo saa 6. Wanasema mazungumzo yao ya kutoka mwezi Mei tarehe 4 mwaka huu hadi sasa hayajazaa matunda licha kuwa na mikutano zaidi ya 4 na Wizara ya Afya. Tunaendelea kuweka jicho